So I said this before that we use insulin as a really good example for hormone to discuss what the endocrine system does. So it acts like a key to a lock, unlocking the cell, and that's simplifying the process. But so being able to talk about what does insulin do. Let's see. Let's see. Yep. And then, like I said, what happens when blood sugar is low, and then, understanding why altered mental status would be an indicator that there is a insulin shock happening. But you would only be able to answer that if you knew that neurotissue relies almost entirely on glucose as a source of energy. So that's how you would get all of the points if you had a question like that. And then, of course, any way that you can, altered mental status has, think about that is a neurological response to an endocrine emergency. So see how these things end up kind of intertwining and relating and working together. So another question, and I know that there's a question in my pack of questions, but having to do with blood type. And I'm going to be honest with you, I still have to think about it, and I still have to make my chart, and I will do that. I will show you how I make my chart. I don't expect anybody to be a pro at this right now. The idea is just that you have a general knowledge that these components are there, and some, multiple choice question could come up as far as if you had a patient that is AB positive and they receive B positive, is there an interaction, or is that okay? Knowing who's who can accept and who cannot, and why. But I will look at that in a little bit more detail, or at least respond on the discussion board, because like I said, I'm not a pro. I still have to make my whole chart, and I have to go, okay, A, B, O, positive, and work it out. So you're not alone. I'm still a student too. So there was a question on the exam that discussed what happens with the heart during non-perfusing ventricular tachycardia. It asked you to discuss the conduction system and how the effects on the cardiac cycle, specifically stroke volume, and why this results in poor tissue perfusion, and why is this life-threatening. Lastly, what does defibrillation do to treat non-perfusing ventricular tachycardia? And I think right there are 6 or 7 things that need to be talked about. So let's see. What's happening in the heart during non-perfusing ventricular tachycardia? That's one. Be sure to address the conduction system. So what is the conduction system? Let's start with that. How does this affect the cardiac cycle? What is the cardiac cycle? I gave a little hint that said stroke volume. So what is stroke volume? Why does this result in poor tissue perfusion? So that's 4. Why is this life-threatening? It seems kind of basic, but don't be quick to say, oh well, obviously if we're not pumping, then it's life-threatening. Why? Always ask, did I answer the question why or how? And then what does defibrillation do to treat? So that's 6. So 6 points. So here I want you, I told you the 6 things that I'm looking for. I want you to be able to tell me those 6 things. I want you to tell me how they are related to each other, not just define them, 6 things, but I also want you to tell me how are they related? How do they intertwine? Your job is to basically try to educate me. Try to bring it, and it's even better if you can think of your own examples or terminology. That's even better, because then it's going to stick with you. Okay, so I think the biggest thing that I saw on this is really not getting detailed in what is the conduction system, how does it affect the cardiac cycle, understanding that there are reflexes that are triggering these responses, which kind of goes back to the homeostasis idea of everything is going to try to find a balance. So if it's out of balance, these reflexes are going to kick in automatically. And what are those reflexes, and what do they do? And for some reason, I do get a lot of missed, and it could just be not really looking or kind of overlooking the last question as far as, why is defibrillation used to try to treat this particular rhythm? I get a lot of, well, it's going to shock it back. Not exactly. It's actually going to stop everything. It's actually going to stop all electrical conduction, all electrical activity, all of it. We are basically stopping everything. And we are hoping that when that electrical activity kicks back in, that it's actually coming from the right place. So, why is non-perfusion tachycardia, life-threatening? I mean, obviously, yes, if we're not pumping and we're not getting the blood out and we can't perfuse to tissues, but we also have to think too, it's not even pumping. So think about what happens to blood. Whoops, I just brought in another chapter into this question. Why did I go back to blood? Well, because what happens to the blood as it's just sitting there in the heart or in the body and it's not moving? It could be clotting. So that could be a problem. Well, we could get the heart maybe back and to do what it wants to do or what it should be doing, but then what if we've got this major clot and it moves up, and then now we've got a PE? Now what do we do? So I want you to just stimulate this type of thinking. This is just the beginning of your paramedic career. So you need to be thinking about this in a little bit more depth. So I had a question that asked, how does the cardiovascular system respond to hypovolemic shock? And then it asks that you address the role of baroreceptors and tell me where they're located, the vasomotor and cardiac responses, which is sympathetic and which is parasympathetic, and the effects on maintaining blood pressure. So if we break that down, we've got how does the cardiovascular system respond to hypovolemic shock, address baroreceptors, where they're located, vasomotor and cardiac responses, which is sympathetic and parasympathetic, and the effects on maintaining blood pressure. So we've got 6 or 7 of those points that I would expect in order to get full points that you hit on. And not just define, but actually tell me, how do they all relate to each other? How do they relate to one another? And so first and foremost, I find that a lot of students will start talking to me about blood loss. Well, blood loss, hypovolemic shock, we've lost a lot of blood. Hypovolemic just means that our volume has depleted. That could be because of blood. It could be because of excessive vomiting. So I always like to point out with my students when I have the opportunity that this is more than just blood. Now, if I were to say, more specifically that, the patient's bleeding out, and then yes, but hypovolemic shock can be a variety of different things. Basically, we're just saying that the volume is depleted. Hold on, I gotta make sure that this does not reset. No. Okay. Then, so to address this, understand that there's 2 goals of the cardiovascular system. There's a short-term goal, and then there's a long-term goal. The short-term goal is to maintain an adequate blood pressure. We need an adequate blood pressure. And if we have an adequate blood pressure, then we can have peripheral blood flow. So we've got all of our tissues and organs have to have blood. That's the short-term goal. The long-term goal is that we need to restore the volume. So that's the second part. So, so the reflexes, again, there's the carotid and the aortic reflex. Those are your baroreceptors. You have to know where they are located. You have to know what a baroreceptor is. The vasomotor and cardiac response, know what both of those are. Understand what they do. Understand which is sympathetic and which is parasympathetic. And ultimately, how do these items here that I just listed, these baroreceptors and vasomotor and cardiac responses, how do they control and maintain blood pressure? So there are a few things that occur. In addition to that, there are, the sympathetic, when you think about the sympathetic nervous system and the parasympathetic nervous, I'm talking about nervous system. I thought I was talking about cardiac. See how the nervous system has a play even in the cardiovascular system. So you have to be able to connect the two, because as I'm leading into this, the sympathetic system is going to release epinephrine and norepinephrine. And I want to know that you know that. I want to know that you know what they're going to do. And so how do they affect this process? What roles do they have in this process? So, the renal system, now that we've finished all 20 of our chapters, the urinary renal system have a play in this as well. We've got, ADH, which is a hormone, and that's secreted, and that a hormone, so that's endocrine. We've got angiotensin 2, which is from the renal system. We just named off what, four different organ systems that all have to do with hypovolemic shock. So at this point, the idea is that you can think about, show me that you're thinking about how these things are related. Think about, show me. Let me know. Let me know that you're thinking about these things, okay? So, anaphylaxis is probably one of my favorites, because it's a great example of so many different systems coming together and working together in a disruption of homeostasis. So, this is just probably my favorite. So I ask, and again, my question kind of seems pretty straightforward and simple, but it's really very intricate. And that's what I'm looking for. I'm looking that you are seeing the intricacies, okay? So discuss the signs and symptoms of anaphylaxis and their cause. What causes blood pressure to drop in anaphylaxis? So there are 5 systems for sure that are involved in this process, different organ systems. There are chemicals that do a variety of different things that I'm looking that you can tell me what are they doing. Not just that blood pressure drops because I want to know what's causing the blood pressure to drop. What chemical, what system is responding to this event? Things like histamine. What does histamine do? Things like peripheral vasodilation. What is that? Permeability. What does that mean? What about the cells that are responsible in this activity? You got basophils, you got mast cells. What do they do? What about the respiratory system? What's happening in the respiratory system? There's, what systems are involved in anaphylaxis? You've got signs and symptoms. If you break this question in and it says, discuss signs and symptoms of anaphylactic shock and their cause. So I want to know, what are the signs and symptoms? What organ systems are they affecting? I want to know why are they affecting it? So, I'll get responses that say, well, you have an allergic reaction and you'll have hives. Cool. Great. Yes, you do. Why? Why do you have hives? What system is that? What's happened? Tell me. Tell me what's happened, okay? Think about those types of things. I'll say, I'll get people that say, there could be facial edema. Yes, there could be. It's a dangerous situation, and there most certainly can be. Please tell me why. What made the facial edema? Okay. All right. So, let's see. That, I think, concludes section or unit 2. Let me pull unit 3. So injury to the respiratory system is a problem and life-threatening because why? What about the respiratory system? We know that it's a closed system. We know that we can have injury to it and rupture or open that system, and then what happens if that takes place? So I would want you to be able to articulate what is this injury? What is that type of injury that can cause a life-threatening situation? I believe that we talked about this in the lab where we discussed pneumothorax. We discussed what happens, why this is a problem, why this could be life-threatening, and so that would be the expectation as far as the answer for why injury to the contained system would be life-threatening. So that is one of the questions that I had in Unit 3 for the respiratory system. And then let's see, we have GI bleeds, which is fairly straightforward. I think what I missed from most answers was that we can have a variety of different signs and symptoms, but I was really looking for a couple of them that distinguish them from one another, because I feel the best practice in learning all of these different things that can go wrong in all of these different systems, I think the best way to do it is to really kind of hone in on something that is unique to that one particular ailment that we're discussing. So upper GI and lower GI, we're going to have some different symptoms, and I got a lot of responses that talked about what causes lower GI diverticulitis is specifically what the question talks about. So I got, what causes that, and that's wonderful, and that's exactly what I expect to see in all of our answers and responses. But particularly knowing the difference of the blood that you may see for these patients, the color of the blood, where the blood is coming from it kind of differentiates between upper and lower. And so that's a useful caveat to know. So that would be something that I would just, I like to bring to my students' attentions when I have the opportunity. Right, so then I have the question, hypoglycemia. Compare and contrast potential complications in diabetes, and to explain how each can result in medical emergencies. The key here is to know the types of diabetes that are within the text, and to identify them, to define them, to find what is the same and what is different. And then the question asks to define Kussmaul's respirations, and so I would want you to not only define it, but I would want you to tell me why is it, what is happening when you have a patient that has Kussmaul's. Tell me in what instance would you have a patient that has Kussmaul's, and why? Why would you have a patient that would present this way? That would be a thorough, concise answer to my question. So that would be my expectation with a question like the hypoglycemia question that I asked in the third exam. It seems pretty simple. It's not very wordy as far as the question goes. However, you have to just remember in your head that there's probably 4 or 5, maybe even 6 different points that I'm looking for a concise, thorough answer. And so it's your job to not just look at, compare and contrast the potential complications of diabetes. What is diabetes? Diabetes is this, this, and this, and this. There's this kind, there's this kind, there's this kind. Okay, great start. Build on it. Put layers on it. Compare, contrast. What's the same? What is different? Why are they medical emergencies? What would indicate to you that you have a medical emergency that is a diabetic medical emergency? What is Kussmaul's? Why do I see it in this type but not in this type? Do I see it in both? That's your job. Your job is to tell me what it is, what it should be, how it presents, why it's a problem. So there's always 4 or 5. Have that in your head. And when you're studying, you'll find terminology and things that urinary system and pH balance. Here I'm asking for some definitions. So what is the relationship between alveolar ventilation, hypercapnemia, a falling pH, and what is respiratory acidosis? And then I want you to discuss what the urinary system is going to do to compensate for respiratory acidosis. So again, this is an example that we have multiple systems interacting with one another and affecting one another and helping one another get back to homeostasis. So make sure that you're hitting what is every single one of these terms. Then make sure that you are talking about how each of these terms are somehow related to one another. Talk about, look, we've got pH we haven't talked about in a hot second. So pH acid balance, that goes back to the very beginning, the first 3 chapters. We talked about homeostasis, we talked about the acid-base pH system, so the buffer system, and go back, pull all of that back. That's the expectation going into the final, is that you'll be able to pull all of this back and tell me how it's all connected. So the next one that I had is pelvic inflammatory disease. I don't think very many people strayed too far off of that one. The big thing on that, again, is just to go back to the GI question, is what makes this so unique and different? What sign or symptom is going to make this really stand out to you? The reason I do this is because, as I said before, it just seems like there's so many problems that I have to know. And how am I supposed to know all of this? And they all have the same symptoms. Right. So what symptom or sign is different and unique to this one particular ailment? Particularly in pelvic inflammatory disease, you've got the shuffled gait. That's one telltale sign. Definitely the complications with sexual intercourse. That's another one. And of course, this particular question says, how are you going to know that it's not appendicitis? Because when we have female reproductive diseases, we do, the pain, again, that goes back to your pain question, where we have this broad receptor field. So it feels that it's in my stomach, but really the pain is coming from the pelvic area. So see how all of these things are coming together. And I'm not asking you to go ahead and stretch, but I do, in that particular question, especially with the appendicitis and the pelvic inflammatory disease, understanding that referred pain is a real thing and understanding how that works is something that you would do well to put into your response. That would, again, that star would just be like, yes, oh, yes, that's awesome. So, and then the last question that I had for Unit 3 had to do with blunt trauma to pregnancy, or a pregnant female. This one is always, and it's surprising to me, but I always get about 95% of the time the same answer. Well, the pregnancy causes the organs to move, and this changes the female anatomy, and it is going to be a high mortality. And then I get that there could be injury to the fetus, and that could be a problem, and the uterine lining, and these are all true, and so these are all points that I want to see, absolutely. But there's always one point that seems to be missing, and this is what kind of, I don't know if it's just you bruise over as you're reading because there's just so much information, but females, their blood volume increases significantly, and so when that happens and they have an internal blunt force trauma and they have an internal injury, they can bleed for some time before we realize, and they show signs and symptoms because they're already compensating for the blood and the fact that they're pumping for 2 people, but they could be bleeding for some time before we realize that, like, oh, wow, okay, that's interesting, and by then it's too late. So the mortality and the mortality for pregnant females, specifically in the text, really highlights that is due to the change in blood volume that females have, and that we may not realize how much she has lost in a blunt force trauma before it may be too dangerous yet. So that is the discussions on all of the exam questions that I had for each of the units. So I think I've kind of really, bait in that I'm really looking for, each question is usually going to have 4 to 5 components in it that I'm looking for, and I'm looking for you to relate them all. I'm looking for you to relate other body systems into play here. That is the expectation. So what I'm going to do is I'm going to get all of this put together and get this one up on Blackboard, and then I'm going to take a look at the questions that I have to see which ones I can answer pretty speedily, and get those out to you as well. Hopefully this is somewhat helpful. That is my hope, and yeah, so